All right. Good morning, everyone, and welcome back to this Healthy Northeast Ohio
Oh,
regional convening. Good morning. Hello. Welcome. Welcome, everyone. If you could go ahead and put your cameras on if you so choose. If you would like to keep them off, that also works for us. All lines should have been muted when you entered, but if you can go ahead and keep those microphones off while we are going through our content this morning, that would be great. But there will certainly be opportunities when you can turn your microphone on and engage with us. So that'll just help with reducing some of our background noise during the technical portions of this event. So again, good morning. And so we're very grateful to have all of our partners together with us once again. We are very excited about the agenda this morning. So we are going to head and get started. My name is Libby McGraw. I am the Regional Community Health Improvement Manager for Healthy Northeast Ohio. I am based at the Center for Health Affairs in Cleveland, and we are the Northeast Ohio Hospital Association, where we aim to be a convener, an influencer, and an innovator that impacts health in the communities where we serve. I am also one of the local site administrators for healthyneo.org. And at this time, I'd like to invite Sarah to go ahead and introduce herself.
thanks, Libby. Good morning, everyone, again. For those of you who haven't met me, my name is Sarah Zabo. I'm a data analyst at the Cuyahoga County Board of Health, and I work with Libby on Healthy Northeast Ohio, and I also serve as one of the site administrators. So welcome.
Thanks, Sarah. And I know many of you have been adding your information to the chat, so we thank you. And we would like to do something a little bit different to start off our morning. We just introduced ourselves, but we would like to learn a little bit more about who all is joining us today. So we're going to do a roll call. And I know a lot of you have your cameras on, which is great. And if you don't and you choose to keep it off, that works as well. There should be a raise hand function right at the bottom of your screen underneath all the images and underneath the screen. So we're going to go through each one of our counties that are in our 9-county region, and we invite you to just raise your hand or give us a wave when we call out your community. So I know some of you might represent multiple communities or multiple counties, so for that you can feel free to raise your hand for any, for just one of them, for all of the counties that feel comfortable for you. So that's how we're going to start our engagement this morning. So do we have anybody on from Ashland County? I know that we have Vicki with us. Good morning. Hi. And Danielle too, representing Ashley. Great. Ashland, thanks. And then Ashtabula County. Hi, Jennifer. Thanks for being with us. Cuyahoga County. Hi, everyone. Good morning. Thanks so much. Geauga County. Thank you. Good morning. Do we have anyone from Lake County with us this morning? Hi, Liz. Thanks. Lorain County. Hi,
Hi, this is
Kat.
Amanda with Lorraine County Public Health.
Hi, Amanda. Thanks. Thanks for being with us. Medina County. Hi, Michelle. Thank you. And Portage County. I believe we have Josh with us. Hi, Josh. A couple others as well. Thanks so much. And then last but not least, Summit County. Hi, Corey. Thanks. Beth, David, thank you so much, everyone. Well, wonderful. Thank you, everyone, and welcome. We are just so pleased to have so much representation from across all 9 of our counties. And so we will go ahead and move on. And before we start exploring the agenda here in a moment on the next slide, if you could take a few moments just to add anything to the chat box that you are really looking forward to getting out of our regional convening this morning. So again, we have a great guest speaker lined up. We are going to have the opportunity to hear from many of you, many of our regional partners, for some of our community health needs assessment updates. So please let us know how you're feeling about what you're looking forward to. We really take your feedback into consideration as we design these events moving forward. And it's very important for us to make sure that this is valuable information to you, because we know that your time is very valuable as well. So thank you so much. Okay, so again, we are going to hear some overview information from Sarah and one of our local partners in just a few moments. We will also be joined by Dr. Lachelle Pugh in a little bit to share some information with us as well, and we are looking forward to that. I know many of you are likely familiar with these slides here, but we would like to provide a little bit of overview information about who we are, especially if anybody is new with us today. So we did launch the publicly available healthyneo.org site back in 2019. We do continue to utilize the Conduent Healthy Communities Institute web-based platform to serve our 9-county region. We currently have a little over 300 health and quality of life indicators. These come from about 30 different sources, in addition to demographics elements that's also available on the site. And to supplement the data that's available, we also have some tools and resources that can support the work of community health improvement. We carry out this work very collaboratively between the Center for Health Affairs and the Cuyahoga County Board of Health. We are funded by a grant through the Health Comp Foundation in Cleveland, and we also have received very generous partner contributions from across our region. So as we continue to refine these regional convening events, we really want to develop a purpose statement to help guide us in moving forward. So in order to do that, we'd like to take a few minutes to gather some of your feedback in real time. And we have drafted this purpose statement, so I'll give you a moment to go ahead and read that. And we would like to capture everyone's input. So in a few moments here, I'm going to share an alternative screen, which will enable us to capture some of that feedback right now. If that doesn't work for you and you'd prefer to send us an email, that works. Or you can also add any comments to the chat box as well. So the purpose statement that we currently have drafted for the regional convening is to connect partners across the 9-county region to allow for shared learning on best practices and cross-sector collaboration on community health improvement efforts. So I'm going to go ahead and pull up our alternative screen to allow us to hear from all of you. So we are going to invite you to pull out your mobile device for this. That might be the easiest way to do it. Or if you would like to use your web browser, that's okay as well. But you're going to go ahead and go to menti.com, and there should be an access code that it asks you for, and you'll see that access code at the top of the screen here. And Sarah, can you confirm that you're seeing the participation screen here? I just want to make sure I'm not still sharing my slides.
I am, and I also added that link and code to the chat, and I will say it is really easy to do it on your phone. You don't need to log in or anything. You just navigate to that site, and then you can just type in the code and then add your feedback.
Thank you. Thanks so much. So we'll go ahead and give you a couple moments to go ahead and let us know how you're feeling about this. And I can go ahead and read the code out loud too, if that helps. So once you get to menti.com and it asks for that access code, the code is 4447 3427. And thanks for putting those in the chat as well, Sarah.
I'm seeing a lot of awesome responses come through. It looks like we have a couple people who've said partnership. I think collaboration kind of goes along those lines.
Yeah, this is great to see. Leading to impact, partnership, yes. We'll give it another moment. And thanks everyone for letting us know what you're looking forward to this morning as well. I'm just looking through the chat now since I have the other screen shared. Okay, great. Transparent, share, equitable impact. These are really wonderful to see. Well, thank you everyone. Okay. We have another couple of moments. Okay, great. And we'll leave that up too. So, and I believe that it's enabled that you can go back and add any content as well. So if you find yourself still working through that, we will receive those answers and that feedback as well moving forward. So thank you so much for participating, everybody. We appreciate that. Okay, we are going to go ahead and move on. And I think, Sarah, I'm turning it right over to you. We have some very exciting site enhancements, some very exciting site updates, and we're looking forward to hearing a little bit from one of our local partners about some local data that we were able to integrate to the website. So, Sarah, take it away.
Thanks, Libby. So yeah, in the next bit of our agenda, oh, Libby, it looks like your slides might have gone away. Okay. As Libby said, yeah, we just wanted to share some Healthy Northeast Ohio specific updates. And the first one was related to the results from a regional convening survey that we conducted late last year. And I know it was around the holidays. So we did have some participation, but we would love to receive any additional feedback that you all might have. But basically, we just created a survey monkey and invited those who had participated in one or both of our regional convenings last year to share, feedback. Specifically, we were looking at feedback on the format and content of future regional convenings as we were planning those events for this year. So again, thank you so much to everyone that took the time to complete that survey. And then the other updates I'll go through are related to some local data, and then just updates related to our demographics data, our data scoring tool, the new socio needs index suite, and then just sharing a couple of success stories that we've worked on. So next slide, Libby. Okay, so as I said, I just wanted to share the results from that regional convening survey that we conducted. So the first question on the left we asked was, overall, how satisfied or dissatisfied are you with the regional convening? And all respondents were either somewhat satisfied or very satisfied with the regional convenings. We were happy to hear that. And we also asked how often you thought the regional convening should be held. So you're going to see that question to the right. So those of you that answered this thought that we should hold 2 to 4 regional convenings per year, with almost half of you preferring 3 meetings per year. So that's what Libby and I have in mind for this year. Next slide, Libby. Okay, so we also asked the question, during future regional convenings, how interested are you in? And then we just listed some different options. So as far as breakout sessions, updates on programmatic efforts, updates on CHINA and CHIP and implementation strategy efforts, and then as well as having guest speakers. And so what we found was that all respondents were either very satisfied or extremely satisfied in hearing updates from regional partners on both programmatic efforts as well as CHINA and CHIP efforts. So we definitely have that in mind. And you're going to hear some CHNA updates today from partners. And then we also saw that the majority of respondents were very interested in having guest speakers present at the meetings, with the remainder being somewhat satisfied. And then a little more than a quarter of respondents were very interested in participating in breakout sessions, with more than half or so only being somewhat interested. So again, just this was really helpful for us knowing, the format that is of most interest to the group. So we appreciate that. And then last slide, or next slide, Libby. So the last question that we asked was related to the meeting content. So we just asked, what topics would you be interested in hearing about at future regional convenings? And this was a select all that apply. So you can see here that everyone that completed the survey was interested in priorities and strategies related to CHINA and then CHIP and implementation strategies. 86% of people interested in hearing about social determinants of health. 71% of people were interested in community engagement and structural racism. A little more than half were interested in best practices. And then almost a third were interested in digital access. And then 14% were interested in COVID-19. So again, we just want to thank you for taking the time for completing that survey. It's just really helpful for us as we plan the events for this year. But if you weren't able to, please feel free to share any other feedback or ideas that you have with us, either via email. You can even put them in the chat now if that's easier for you. But we really want to make these, events impactful and meeting your needs. So please know that we're open to any and all feedback. Okay, Libby, I'm going to go ahead and pull up the website. Libby, I only see your video, so can you give me a thumbs up if you're seeing the website?
I'm seeing the PDF that you have in your first tab right now.
Okay, perfect. Thank you. So, as I said in the slide and updates, I also wanted to share an update related to local data. So we did put together this FAQ document that relates to adding local data to the site. And this will be soon added on the how to use this site page. So you can just kind of keep an eye out for that. But for those of you who might not be aware, the majority of the data on Healthy Northeast Ohio is maintained and curated by our vendor, Conduent Healthy Communities Institute. But we do have the ability to add local data just so long as it meets certain requirements. So in this FAQ, we kind of just summarize that up at the top, and then we just want to share what are some of the advantages of local data, like making it more accessible, increasing transparency, maybe saving time if you receive data requests frequently about a particular topic. Also giving some ideas of things to consider when adding local data, like would it be useful to your organization and partners? Is it different than what's available on the website? Is it something that you're going to continue to collect? And then we've also listed some examples just to kind of give you a sense of what might be added. And I'll show you those, some examples briefly after this. And so really, we just wanted to kind of put it out there that if you have local data that you're interested in having added to the site, we just encourage you to reach out to Libby and I, and we would be more than happy to talk that through with you in more detail. And I wanted to mention that in the near future, we do plan on reaching out to partners because we just really want to learn more about the data you may be collecting as well as your data needs. So related to examples, just going to come to the website. I just wanted to mention a couple examples of local data on the site, and then I'll show you one. So if you go to the Explore Data tab, and then this first item in the dropdown, the Search for Data and Curated Dashboards page, you're going to see all of these curated dashboards. Some are just lumping data that is maintained by Conduent by like a topic area, so maybe like COVID-19, for example, but some of these dashboards are specific to local data. Excuse me. So one example of local data that we added to the website is this Cuyahoga County childhood lead poisoning data. And this was updated, I think, earlier this year with 2020 data. And then we also have a curated dashboard that includes some select indicators from the 2019 Cuyahoga County CHNA. So we'd be, again, more than happy to have conversations. We know everyone's like just starting their next cycle, but maybe later this year, we can revisit that with you all. And then most recently, we added this early childhood health and well-being curated dashboard. So this includes Cuyahoga County early childhood data, and we're just very excited to highlight this today. So this dashboard includes 4 Ohio Healthy Programs indicators from the Early Ages Healthy Stages Coalition, and then 3 indicators from Better Health Partnership. And if you're not familiar, the Ohio Healthy Programs is a voluntary statewide designation for licensed early care and education programs, and it focuses on creating healthy eating and activity environments for young children. And then the Better Health Partnership data is from their initiative, and that's provided to them by several healthcare organizations. So dashboard where we can add custom content, so this kind of like intro text up top, and then I thought I would just quickly show this map. So on the site, newer features, we can create these, they call mapped resource collections. So this map shows all of the currently designated Ohio Healthy programs in Cuyahoga County. And we can even color code these flags just to indicate the type, for example, if it's center-based versus school-based. And then we have links to both Early Ages Healthy Stages and Better Health Partnerships websites. And then in the dashboard, you're going to see there's a location drop-down that you can use to select whatever location you're interested in. So for the Ohio Healthy Program data, the majority of these indicators are available for 2015 to 2021, and they do have breakout data available, such as the Ohio Healthy Program designation type, the age of the children, and Ohio Healthy Program healthy policy type. And these indicators are available at the Cuyahoga County level. And then the Better Health Partnership data, that's available for 2019 and then 2020 to 2021. And that's available at the county and zip code level, with the exception of blood pressure, which is currently available just at the zip code level. But if you do click on an indicator, you can dig deeper into that. So again, I just wanted to quickly show you some real life examples of local data that can be added. And now that you've seen one of these dashboards, I want to invite Allison Patrick. So I'm just going to stop sharing briefly. Allison, I think I saw you had your video on, but Allison is a program manager in the maternal and child health program. Take a minute or two just to share a little bit about her experience with having this data uploaded to the site. So Allison, take it away.
Good morning, everyone. As Sarah mentioned, I'm Allison Patrick, and as part of my job responsibilities at the Cuyahoga County Board of Health, I have been the team lead for the Early Ages Healthy Stages Coalition since 2014. If you're not familiar with our work, we're a multi-sector collaborative that is focused on improving health and well-being for children ages 0 to 5 in the county, predominantly through licensed childcare programs. And as a part of Early Ages Healthy Stages' new strategic planning process, we recognized a need for early childhood specific data as a way to ensure that we are making data-driven decisions around the work of the coalition. And so as we had entered into partnership with Better Health Partnership in receiving the health data, we were somewhat spinning our wheels about how we make this data publicly available to not only the members of our collaborative, but also for the benefit of the community. And so it's been a great opportunity to work with Sarah and Libby in bringing the data to life on the Healthy Neo website. And we're really excited to be able to connect the dashboard to our website as it's currently being redesigned as a way to really bring to light the issues that young children in our community are facing and really allow us to be very driven and informed in the ways and in the spaces and places in which we do our work. So it's been a really wonderful partnership and a great way to tell a good news story as well around our work around Ohio Healthy Program, which is actually a statewide project again, that is really focused on engaging the early childhood community in addressing the nutrition, physical activity, and social emotional well-being for young children. So we're really excited to be able to share the outcomes of our local implementation on that work. And also they're excited for the opportunities as there are other counties within the Healthy Neo region that also implement Ohio Healthy Program and ways for all of us to begin sharing our data and telling that story in early childhood. So again, we've really appreciated the partnership and are really excited about the data and the opportunities to use the data, and hope the data is also useful to other folks as well.
Thanks so much, Allison. I really appreciate it. And again, just to thank you for your partnership as well as the partnership of Better Health Partnership. We really appreciate it. So I'm just going to go back to the website. So just bear with me for a second. Libby, can you confirm again? Are you seeing? Perfect. Thank you. Okay, so I just have a couple quick updates that we also wanted to share before we move into the partner CHNA updates. So the demographics dashboard that we have on Healthy Northeast Ohio, just if you're not familiar, it has 250 demographics variables that are available at the state, county, and zip code levels. And that data comes from Claritas. So I just wanted to share that that dashboard was recently updated with 2022 demographics estimates. And then as a result, we have updated the demographic profile PDFs for each county. And I just popped onto Ashland County's page as an example, but you can find that here on each of the county pages. Excuse me. And then the regional demographic story, which is found in the Explore by County dropdown, that was also updated. So I just wanted to mention that. And then I also wanted to share that the data scoring tool reports were updated for each of the counties, and those have been added to the website. And I've presented on that tool at a previous regional convening, but just like as a quick refresher, the data scoring tool uses methodology that was developed by our vendor, Convening HCI, and it provides a systematic ranking of indicators at the county level to help identify areas your county may be performing well in, and then areas that have room for improvement, as well as to help with setting priorities for community health improvement. So those also can be found on the county pages. So again, over here, so we have a methodology document, and then if you just click the data scoring tool, you'll see the actual PDF. And then those documents all can also be found in our resource library if that is easier for you. And then we also wanted to share, this is a brand new suite that has been added to the site. So it's called the Socio Needs Index Suite. And you can find that in the Explore Data dropdown. But Conduit just launched this suite in mid-March, so it's really new and we're excited to share it. So this suite is a tool for assessing, planning, and collaborating on community health improvement, and it can be used to identify under resources down to the zip code or census tract levels to help inform local decision making. And I'm not going to click on them for time's sake, but if you went to the 3 indices that I'll cover in just a moment, there's maps, and on the maps, the darker the color, the higher the relative level of need within the community. So as you can see here, this suite does include 3 indices. So the first is the Health Equity Index. And if you're familiar with the website, this used to be called the Socio Needs Index. So not to be confused with the Socio Needs Index suite. But this is a measure that can be used to identify areas at highest risk for experiencing health inequities. We also have the Food Insecurity Index. This was added to the website in, I think, early last year, but they've moved this under, Conduit has moved that under this suite. And this can be used to identify areas at highest risk for experiencing food insecurity. And then lastly is the Mental Health Index. So this one's actually brand new, and this can be used to identify areas at highest risk for experiencing poor mental health. And if you missed it, last week we did have a mental health webinar, so you can feel free to watch that recording. That can be found in our resource library if you want to just learn more about that particular index. And then lastly, I wanted to just mention that we have added a success story section to our About Us page, so that can be found under Learn More About Us. So if you just scroll down, we have a success story section. And our hope really is just to be able to share examples of how you all are using the platform in your work. So I just wanted to highlight our first 2 success stories that we have worked on. So the first is our Mastery School of Hawken intensive course success story. So just in a quick nutshell, we partnered with faculty from the Mastery School of Hawken on a 3-week intensive course with their high school students. It was a really great experience. And so we presented the students with this challenge to identify the chronic illness or community condition that most impacted Cuyahoga County. And then they were also supposed to identify an evidence-based solution to address it. So the students utilized the indicators on the website as well as our promising practices database for this course. So I encourage you to check that out. And then the second success story that we've worked on, this is our Vaccine Ambassador Toolkit webpage. So this was a collaborative of partners in Cuyahoga County who worked together to create a toolkit for vaccine ambassadors that included vetted COVID-19 resources that were aimed at increasing levels of vaccine readiness, and then also building trust in communities of color. So they worked with us to create this web page that included this content, and it actually has been one of our top visited pages on the site since that page launched. So that's pretty exciting. So thank you to anyone who may be on this call that worked with us on those. We really appreciate your partnership. And if you have an example of how you have used Healthy Northeast Ohio, we would truly love to hear from you and collaborate on a success story to showcase your work. So please feel free to email Libby or I, and then you can also use the contact page on the website to reach out to us. But again, we really would love to showcase your work and just learn more how you're utilizing the website. So I think that concludes the website updates. So Libby, I'm going to turn it back to you for the partner updates on CHNAs.
Thank you. Thanks, Sarah. Yes, lots of updates, and we do continue to communicate a lot of these through email and through our quarterly newsletter. So be sure that you do sign up for that. And as Sarah alluded to just earlier when we were talking about some local data opportunities, thanks, Sarah, for kind of putting the bug in people's ear. We will likely be reaching out to many of you to start that process, and we may be even conducting some focus groups to perhaps see what some existing data gaps are for those partners in the region. So just a couple things that are on the horizon as we enter Q2 and Q3. So thanks again for those updates. Thanks, Allison, for providing that partner sharing experience. We appreciate your feedback, and we were excited to be able to launch that new dashboard. So with that being said, we are going to move into our partner sharing for that portion of the agenda. We have asked several of you, a lot of our regional partners, to provide some brief updates on your community health needs assessment processes. And I know that some of you I've talked with already through email, so I have a list going. I'm just going to go right down the list. And if you can share a couple of updates on your projects, any updates perhaps from last time. And if you don't have any updates since the last time we convened, that's okay too. I think it would be helpful to hear where you're at in the project either way. So I also realize that there might be projects that we are unaware of that are currently being conducted. So we will also do an open call at the end if there are other projects or other individuals on the call who are in the process of conducting some sort of needs assessment, maybe more targeted or at a local level. We do invite you to share those as well. We'll just hold those till the end. So we will go ahead and move through our list. So first up, we have Vicki Taylor with Ashland County Health Department. And you should be able to just unmute everybody. I know that I think I said that at the beginning that your lines were muted when you entered the room, so you should be able to unmute yourselves at the bottom of your screen.
Well, good morning, everybody. Can you hear me okay? Yep. I'm Vicki Taylor from Ashland County. I am the health commissioner, also leading the process for our current CHA assessment. We are working in partnership with University Hospitals, who is our major hospital provider in our county. I see Danielle Price is here with us today. Great partnership and excited to work with them on this project. This is my first time running through this, so all the support we're getting is wonderful. We have also hired Conduit HCI as our consultant to lead us through this project. Most of our data right now is going to be secondary data, probably collected from this source right here, because we did a big survey on our last one. And because of COVID, like most of us, we didn't really enact much in our previous CHIP. But we are doing some primary data with 15 key informant interviews and 4 focus groups. And part of our conversation will be about how COVID did impact community health. And so that's one area we're trying to get some information on. We have set our first community partner meeting for May 9th, and happy to report that I have like 30 representatives from our community coming to that. We have great partnerships with in our community, which is an advantage sometimes of a small community. So we're looking forward to hearing from them, to seeing what they see as some of the issues we have in the county and what areas they want us to focus on. So that's kind of where we're at right now. But one thing I'm really happy about is to be able to have this data available on this website so that we can create our own charts and graphs and visuals from this data to put in our report. So grateful for that opportunity and grateful to work with our partners at Conduit and University Hospitals. So.
Thank you, Vicki. Thank you so much. Appreciate that update for Ashland County. So next we have Jennifer Cleveland with Ashtabula County Health Department.
Hi, everyone. I just wanted to give a quick update on where we're at. The mid-May, we will be meeting with, actually having our prioritization meeting, and we'll be doing a closure meeting for the past that we weren't able to do. We had a loss of staff, and so we're still kind of catching up with that. We want to have a actual closure meeting to go over what happened in the past and in the past cycle. So, and this is only going to be with our two health needs, priority needs committees. I have been in the process of doing a survey of those committee members so that we can, moving forward, improve how we manage that process. Then we will be meeting with the committee members and Illuminology for moving forward. And then in end of June, we will have our prioritization with Illuminology and the Healthy Ashtabula Committee. By the end of June, Ohio State University will be working with them to develop our chip. So that's where we're at right now.
Great. Thanks so much, Jennifer. Okay, next we are going to hear from Cuyahoga County. Allie Goff, are you on our call here? I'm looking right now. Oh, I see you, Allie. Okay, great.
Hi, good morning. Thanks so much, Libby. Hi, everyone. I'm new, so I'm going to introduce myself. My name is Allie Goff, and I work at the Center for Health Affairs as a program specialist, where I work to support the CHNA efforts. Just to give you a brief update as to where we are right now, we are in the community input phase, and we are currently working on our key informant interviews. The key informant interviews will include questions on the health needs of vulnerable populations and barriers to accessing care. Once the key informant interviews have been completed, the team will transition to conducting focus groups next. To also share this as well, this Monday we are reconvening everyone for our CHNA roundtable. So we are looking forward to engaging with everyone this Monday and sharing more information with our partners. What's next after the focus groups is that the focus groups will be aimed at discussing needs and strengths of the community and the barriers and opportunities for community health improvement. The target audiences for the focus group will include refugee populations, the Spanish-speaking population, to ensure diverse representation of entities and key stakeholders. And finally, once the analysis is completed, we are looking at a target report completion date of August 2022. Thanks, everyone.
Thanks, Allie. Thanks so much. Okay, next up we have Geauga County Public Health. I believe we were potentially going to be hearing from Sarah Sullivan. I don't see Sarah on today, so we will go ahead and move on to our next county, which would be Lake County General Health District, and Liz Mazur.
Good morning, everyone. My name is Liz. I work in marketing and communications, which is relatively newly established role at the Lake County General Health District, and I also facilitate our CHIP work group. Kind of along with everybody else, we're making progress. We did collect at the end of last year our secondary data and did that secondary data analysis. And then in the first quarter of this year, January, February, we sent out our community resident survey. It was mostly electronic. We did do some paper surveys, but very few came back that way, as I'm sure you can all imagine. And we collected over 1,800 responses, which for us is not bad. We're a small county, and it is just slightly more than we got in our last go around in 2019. So we are happy about that. And we did conduct our qualitative primary data collection through focus groups. And we did one community leader focus group, but our community focus groups were done in collaboration with partners who were representing some of our marginalized communities. So our LGBTQ+ allies organization here, the NAACP, Black Lives Matter, Lake County. We did one particularly focused on seniors, and then also with the city of Painesville, which is one of our higher SBI communities. And like somebody else mentioned, maybe Ashtabula, a lot of these qualitative groups were really focused on getting feedback on the impact of COVID on health factors and social determinants. And like many others, we are contracting with Conduent to do the data analysis and initial report. We have a meeting next Wednesday, May 4th, where we'll be doing our prioritization with Conduent University Hospitals and then a variety of different community partners. So we're looking forward to that. Our goal is to have the CHNA completed by the end of July, I believe, and then ultimately we're looking to then shift gears into our chip process, and the goal is to have that done before the end of the year.
Great, thanks so much, Liz. Next, we have Kat Bray with Lorain County Public Health.
Good morning. So with our CHA update, we have done our stakeholder interviews and focus groups are in progress. We have also completed all of the census data and vital statistics. Our school data is a bit delayed, but we're aiming still for a report to be completed in June with a August or September rollout. And we are still fitting everything under the same same 5 CHIP priorities identified in the previous cycle. With definitely, though, an increased note on social determinants of health and as factors that are continuing to contribute to poor health outcomes. And we're looking to make an intentional link and connection written throughout the report on the racial disparities, and that's something that is a little bit of a newer approach, and just continually making that connection with that linkage throughout the report. So I'm looking forward to how this rolls out. And I think that's about it.
Thank you, Kat. And Medina County Health Department, I believe Kristen Hildreth was planning to join and she had a conflict. So she did let me know that this morning. Michelle, if you have any updates that you want to provide, feel free to let us know if there is anything else for Medina CHNA that you guys would like to share with the group. Not to put you on the spot, Michelle.
Okay. Kristen is the best one to talk about this, so I will hold off until Kristen's available. Thank you,
No
Libby.
problem. Thanks, Michelle. Appreciate it. Okay, next we have Portage County Health District, and we'll be hearing from Josh Sexton.
Good morning, everyone. So yeah, we are beginning our next CHA process, and we are getting ready to do the YRBS in our schools, and focus groups will be coming up soon. Our goal is to have the new CHA and CHIP by the end of this year. We're working along University Hospitals Portage, and we have decided to contract with Conduent as well, like many of them have.
Thanks so much, Josh. Appreciate it. Okay, and next up we will hear from Corey Kendrick with Summit County Public Health.
Hi, everybody. Can you hear me okay?
Yep, we can hear you great.
Okay. Like most of you guys, I heard we've had some staff issues as well. So we are working on our CHA. It's going pretty well. We are about 95% complete with our quantitative data collection. A little bit unique. We do everything in-house. We also perform the community needs assessment for SUMA Health Systems in tandem. So we work on both those assessments at the same time. Currently, right now, we are collecting key informant interviews. We decided to do that via digital survey this time around, as opposed to individually, which has been quite successful. I think we have like over 100 key informant interviews in so far. We are collecting information on focus groups. We've done a few so far. We have about 7 more scheduled. And we also have an adult well-being survey that we're putting out, and we're going to various places throughout the county offering gift cards for incentives, trying to get individuals to fill that information out. So we're really pushing this time around for qualitative data, since there are some, as we all know, some barriers to the quantitative data this time around with COVID. So our goal to have everything completed and published would be 1st of October this year, and then on to the CHIP. And we are planning to do our next YRBS next fall school year. That's all I
Great.
have.
Thank you. Thank you, Corey. I did receive a written update from the Cleveland Clinic as well, which I will read here, and that is that they are currently conducting its 2022 CHNA reports. The Cleveland Clinic has completed their secondary data analyses and are now compiling primary data. Their primary data collection consists of individual community leader phone interviews, as well as hospital-specific virtual group engagement sessions. Conduent HCI is also their consultant. So that is our written update for the Cleveland Clinic. And at this time, I would like to open it up to any additional partners on the call who are going through this process for any additional projects. So again, if there is something else happening in our region that we might not be aware of, we'd love to hear any updates that you might have. So if anybody would like to come off of mute and share anything, we will go ahead and give that opportunity here while we prepare for our guest speaker. Or if you also would feel more comfortable using the hand raise function at the bottom, that's also okay as well. And we'll give that a few moments. Okay. All right. And if there are no updates, if there are no additional updates, that works as well. Okay.
Libby, I'm gonna.
Oh yeah.
Sorry, I was just gonna interject. I see that Michelle did add a comment in the chat. So she said, I will share with the help of our epidemiologist, Medina County has compiled a data brief connected to our CHIP indicators, as well as some data on the impact of the pandemic, and she included the link. So thanks, Michelle.
Great. Yes, thank you, Michelle. Appreciate that. Okay. All right. Thank you, everyone. Well, thanks again for those updates. It's really exciting to hear about what's on the horizon and the work that's being conducted in all of our counties. So we look forward to seeing many of those finalized reports and seeing the status of health in all of the communities that we work with. So we are going to move on to our guest presentation. I am very pleased to introduce this individual. Our guest speaker today is Dr. LaShale Pugh of the Northeast Ohio Black Health Coalition, where she is the Research and Evaluation Director. Dr. Pugh, we welcome you and we invite you to take it away. I believe I have your slides here, so I will go ahead and pull those up for you.
Okay, thank you. All right. So our title, effectively engaging the African American community, and we see this as the cure for Black trauma. So, right, justice. The cure for Black trauma is justice. Go ahead, next slide. So, the Northeast Ohio Black Health Coalition is working to educate, advocate for, and empower the community. And it's more than just dropping in. So we're going to discuss how the Northeast Ohio Black Health Coalition, as a leader in the introduction of culturally proficient community engagement. Next slide. So we're going to talk about best practices for engaging the community at all levels. And the most important thing is understanding the dynamics at work across the social realm, because that tends to guide how we approach the African American community. Next slide, please. So the Northeast Ohio Black Health Coalition is a social justice organization, and it was created to address the impact of racism on African American disparities, including policy inequities, historical trauma, food insecurity, research, behavioral health and addiction, and health promotion by working to empower, educate, and advocate for health equity in underserved communities. The organization was created because there was a need, there was a lack of these kinds of activities, and that is why our founder, Ivanka Hall, created this organization. She wanted to change things. She wanted to change people's lives and make them better. Next slide. So race and racism. At some point throughout history, humans began to group people based on shared traits, shared physical traits. Sometimes language was used. This practice started in the 17th century. It's been language, it's been physical characteristics, such as skin color, and other characteristics. So, and then we call it a race. We set people aside by their skin color and refer to people with that skin color as a particular race. While racism is a belief that there's a fundamental determinant of human traits, and this can produce a race that is superior to all other races. Next slide, please. Excuse me. And so there have been a couple of times throughout history, multiple times, not just once, but in Germany, the Jews were seen as an inferior race of people. Wasn't based on skin color, but that's one example. And then Europeans saw Africans as being an inferior race. And so this has affected the African American experience here in the United States. So we had slavery in America for a period of 46 years. Then there's the period of segregation where Blacks were treated differently and not allowed in places, couldn't drink from the water fountains, not allowed in certain restaurants, certain hotels. So we had to have our own. And so the period of time since 1954 up until the present is the smallest part of our experience in this country. But still, some of our experience is based on some of what's happening to us today is based on things that happened over a period of more than 300 years. Next slide. So when we look at historical trauma, we had slave medicine. Dr. Marion Sims was a gynecologist, and he did not start out as a surgeon, but he practiced operating on slaves and without anesthesia. There was a belief that those slaves did not feel pain in the same way that whites did. And I mean, it was unethical treatment, right? He performed surgeries. He introduced a lot of techniques. He didn't start off as a surgeon, but through practice became a surgeon by operating on those slaves. Holding them, I looked up some information on him, and there were some women that he had for 10 years or more and performed 30, 40 surgeries on without anesthesia. Then there was the Tuskegee experiment. This was a study of men suffering from syphilis. The study began, I believe it was in the 1970s. I'm sorry, I forgot. I looked it up. I forgot the date that it started, but it was a long-term study. And even though penicillin to treat syphilis was introduced during the course of the study, the participants in the study were not given the medication. They just continued to study them for many, many years. Then there is Henrietta Lacks. She's a woman who was ill, went to the hospital. While she was there, they took samples, tissue samples, and they found that her cells were able to grow and reproduce in the laboratory setting. Her cells, called the HeLa cells, and that's from taking the first two letters of her first name and the first two letters of her last name. There's those cells, I believe they're still using them in research. And those cells were able to, or using those cells, the medical community has been able to come up with treatments for different types of illnesses. And so it wasn't that they used the cells, but they used them without her permission. At some point, her family received funds, but this was an example of not respecting the individual, and just continually using those cells. They've made probably billions of dollars from the research that those cells has provided. So those things have made some Blacks fearful, and has caused distrust in the medical community among Blacks. There were two periods where African American health status proved. So during the post-Civil War Reconstruction, there was improvement. It's linked to the Freedmen's Bureau legislation. Black medical schools were established, and hospitals and clinics throughout the South, which helped to improve the health. And this may have actually saved many African Americans from extinction. It helped to improve the health, and that's why we're still around. Next slide, please. The second period was the Civil Rights Movement. Racial discrimination was outlawed in government-funded health programs. You had Medicaid and Medicare. So these things, these programs helped to improve health. Also, hospital desegregation, both for the staff and the patients. So patients could then see individuals who looked like them in that setting, which could make them feel a little more comfortable. And there was also an increase in the number of community and neighborhood health centers. So some of those movement gains were halted. And since 1980, there's been a big decline in the health status of African Americans. You have things like programs like busing, the war on drugs. Drugs took a huge toll on African Americans. Closures of mental health facilities. Excuse me. And that was really unfortunate, because I can recall, excuse me, I live in Youngstown, Ohio, and there was a time, well, kind of still is, but I can remember when a lot of mental health facilities were closed. And what happened, a lot of those people ended up living in group homes where they are free to roam the streets during the day. I'm going to say maybe this is probably 20 years ago. There's a guy that used to be downtown Youngstown every day, walking around, sometimes sitting on a bench, talking very loudly to someone that none of the rest of us could see. that's one example. I just saw so much of that, and it was from individuals who weren't necessarily getting the mental health help that they needed, and they were left to their own devices most of the day. You're talking about individuals that went from being in a controlled environment just about all the time to being left on their own to roam the streets. I've been accosted by, well, not accosted by, I was in a McDonald's, which is not far away from where there's several of those group homes, or there were at that time. And this woman was cursing very loudly, and I thought she was talking to me. I mean, I was a little bit nervous. I eventually realized that she was not talking to me, but I think it's not safe for those individuals, and I think they deserve better than that. Okay, next slide, please. So in 2016, we got Obamacare, Black life expectancy, but Black life expectancy has still dropped. So it dropped from 72 years to from 75 to 72 years. And so we've lost almost 3 years of life expectancy. And this was just last year that information was reported. So life expectancy for African Americans is the lowest it's been since 2001. COVID-19 had a detrimental impact. 2.9 times the rate of whites were to be hospitalized.
Out to a couple more on Carrie's list that she's gonna.
Okay, so we're African Americans are hospitalized at a higher rate and also more likely to die from COVID-19. And part of that has to do with in African American neighborhoods, we've been affected by redlining. And so all of the disparities, and especially the health disparities in housing, health, and even wealth, levels of wealth are higher. They're all exasperated by the long-lasting effects of redlining. We've seen increase of anti-racism in hospital settings. We're partners on an initiative looking at racism in healthcare settings, and there was a survey, and based on the results of that survey, we've learned that African Americans are more likely to experience racism in a hospital setting, which can also have a negative effect on our health when the place that we go to, if we're not treated with decency and kindness. Then there's also menthol restrictions. So when we're talking about menthol, we're relating it to tobacco use, and African Americans have been targeted by the tobacco companies using mentholated tobacco products. And now they're also using other flavors to get youth to smoke and use tobacco products. So we find that the African American community experiences, we have higher rates of blood pressure and higher rates of cancers and other illnesses that are directly related to smoking. Next slide, please. So, in 1968, the Kerner Commission on Civil Disorders released their report of how to improve things. Reverend Dr. Martin Luther King Jr. pronounced the report a warning of approaching death, but also providing a prescription for life. Some of the things that were discussed in that report, it was said that we needed areas not to be segregated. We needed to not have this separation between blacks and whites. It's interesting because the Kerner Commission report was not the first report. Usually after periods where there were these riots resulting between blacks and whites, there was a report produced, and there were multiple reports dating back from the early 1900s, even up to 1968, and the results weren't heeded. And so we've seen these things be repeated multiple times. And one of the main results of that is our poor health, higher mortality rates, higher incidence of disease, lower availability and utilization of medical services, and our infant mortality rates 58% higher than for whites. So these are all problems that don't have to exist. Next slide, please. So African Americans suffer from race-based disparities. These disparities have existed for injuries. It's impacted our health, and it's impacted the population as a whole. Next slide, please. Reason why. So the slave deficit. This is a report that was written by R.G. Hood, and the slave deficit, he talks about it. So he took over the National Medical Association, and he talks about the problems. Healthy People 2000 was introduced, but he says that all of what's happening now goes back to times of slavery, and there's a link there. Some of these things some of the issues have carried forward since that far back, and the health problems have not decreased. Okay, they've increased. And it goes back to racism. Racism in medicine at all levels is deeply ingrained in the healthcare system in the US. So to eliminate persistent race-based disparities, we must make dramatic changes in policies. Sometimes the policies hide the structure, functioning, and financing. And so we need to produce a system and a workforce that is culturally competent in dealing with the African Americans. Next slide, please. That slave health deficit has persevered and has not had significant change throughout U.S. history. And we're still seeing in the same ways, which is not helpful. Next slide, please. So, health is related to education. Okay, so lack of a high school diploma means people won't be able to get a good job, and they won't be able to make enough money, and it can lead them to still be in poverty. So segregation and lack of affordable housing, also environmental hazards. Some of the housing that many African Americans can afford is not healthy. It's not healthy housing. And so there's frequently lead, not just from the lead paint that was previously used, but lead that, when those paint chips fall off and get into the soil, you have that lead in the soil. Lead naturally exists in soil, but at low levels. But it is from the lead paint, those levels can increase. And so, even dust blowing in from the outside can bring lead into homes. And then, especially in places where you see high rates of asthma in children, it can be devastating. And also cause many other issues. It can cause issues with brain development and learning disabilities. And sometimes there is definitely a connection with behavior problems. There's often a link to lead. Employment. We need higher unemployment rates and jobs that may cause other issues is a problem. And so these are some of the issues. So education, housing, and employment are the three of the main issues that we need to deal with. Next slide, please. So to eliminate persistent disparities, we need change in policy. All policy is health policy. So when we look at introducing policies, we have to think about how we can improve health through introducing new policies. We need direct efforts to produce a system and workforce that are culturally proficient in dealing with African Americans. Did I see a hand? I saw a hand float up the screen.
Sorry,
Somebody has a
I was
question?
clapping. It was a clapping emoji.
Oh, it was clapping. Okay, thank you. I didn't realize what that was. Next slide, please. So I take it you agree that all policy is health policy.
Yes, yay.
All right. So structural racism is evident in every system, in our health care system, in our food systems, our education systems, our environment, and in policies, in transportation systems that don't go to every neighborhood. What about those individuals who don't have a car? What about the individual that has to walk 20 to 30 minutes to get to the bus, and then they have to take the bus all the way across town? If it takes a person hour and a half to 2 hours to get to work using public transportation, how is that efficient? How is it helpful? And then you've got racism in housing and availability of housing, and even employment. Next slide, please. Cultural proficiency. So we've got Black Lives Matter, All Lives Matter, Blue Lives Matter. Black Lives Matter started, and then we began to see that phrase used but altered for others. To say Black Lives Matter doesn't mean other lives don't matter. It just means that the reparations that are needed to improve Black lives. I mean, the time has come. The time has come. We've suffered. The African American community hasn't been given a fair chance. Next slide, please. So, why do we need cultural proficiency? Cultural competence is being able to interact with people of different cultures and different backgrounds, and recognizing them. Cultural This should say sensitivity, not insensitivity. Cultural sensitivity is referred to sometimes as cross-cultural sensitivity, but being aware of other people's cultures and being sensitive to their needs and their identities. While cultural proficiency, this is the knowledge, skills, and attitudes that enable people to work well with people of other cultures and being supportive of people in cross-cultural settings. And because we are interacting with people of different cultures all the time, cultural proficiency is really the most important of the three. Next slide, please. So, health equity. We will have health equity when every person has the opportunity to attain his or her full health potential, and no one will be disadvantaged based on their social position. We're not there, but this is where we're trying to get. And it is opportunities like this that allow us the opportunity to move forward. Next slide, please.
And Dr. Pugh, I'm going to interrupt you really quickly. I think I'm just doing a quick time check, and it looks like we have about 5 more minutes before we have to move on to our next part of our agenda. So I wanted to give you that update.
Okay, I'm gonna get quickly through it. Let's see. So we need a workforce that is culturally competent when dealing with Africans. That's really important. Next slide. Trying to see where my slide is. And we have to change the way we engage African American communities. Relationships takes time. It takes time to develop that trust. You can't just come in and say, this is what we need you to do. You have to come in and ask the community, what is it you want? What do you need? And we will tell you what we need. And then we can work together to try to achieve that. Next slide, please. So white Americans have never understood what the Negro has never forgot. White society is deeply implicated in the ghetto. White institutions created it, white institutions maintain it, and white society condones it. Next slide. We didn't create it, right? Next slide, please. Okay. Northeast Ohio Black Health Coalition matters because we've changed the way African American communities are engaged. We deliver information in a language that is understood by commoners. We've built ongoing trust and integrity, and we're willing to be present in matters that in the moments that matter most. And we've taken an advocacy lead on expanding services for needs of the African American community. Next slide, please. And I'll talk about one of those opportunities. We were able to provide food for many families during the shutdown when the schools closed, and children in Cleveland had to get on the bus and go to the school to pick up food that was being provided. Our organization introduced a program to provide food that was ultimately being delivered to those families. Especially, and I'm speaking specifically of families who had disabled children who were not able to get on the bus to go to school and bring it back. And so we saw a need and stepped in to fill that need. So, and some of the ways to get involved with the NEOBHC, with our or other community level partnerships, working in the community. And then seek ways to advocate for funding of African American organizations. Billions of dollars are awarded every year to organizations, but only a very small fraction of that money goes to African American organizations actually doing the work in the community. Next slide, please. So change will come through policy change, having progressive leaders, changing school funding formulas, bring food back into the schools, food that's actually cooked there. Now it's prepared somewhere else. And in some school systems, they got the central kitchen and then they deliver food to the schools. Kids don't like what's in the schools in either. Bring education back, bring trades. Everybody's not going to go to college, and some people are going to need a job where they can bring in an income right out of high school. Lead, that's the issue. People need a living wage. Medical residents should visit each area of practice. I think that's next slide. That's probably the last slide. And here's our contact information if you are interested or want to reach us. Thank you very much. I hope I've given you all something to think about today. I hope the information was helpful. And
Thank you so much. Thank you, Dr. Pugh.
You're welcome.
Okay, great. We appreciate that information. This has been very impactful, and I want to be sure that we open it up for any questions or comments. And if you feel like you want to add those to the chat box, that works. Or if you'd like to come off mute and you'd like to use the raise hand function, we can certainly call on you that way as well. So as we're getting ready to move into the conclusion part of our event today, go ahead and let us know if you have any questions for Dr. Pugh or any of the content that she covered. And then Sarah, I'm going to look to you to see if there are any questions coming through in the chat box.
I'm not seeing any questions, but Dr. Pugh, there's a lot of positive feedback and appreciation for your presentation and the information. So thank you again.
Yes, thank you so much. Okay. Well, I believe we are just about ready to wrap up. But before we do, please take a few moments to let us know what you'd like to see more of during the next regional convening. Again, if this is something that you'd prefer to contact us about via email and add a little more context, that is very, very okay with us. But otherwise, we do request that you add anything into the chat box that you find impactful during these events. I believe this is the third time we've brought everybody together. So again, we're very open to your feedback, and we want to make sure that we are being responsive to the needs of all of you. So as a reminder, this event was recorded, and we will share the recorded link after our event. We will send that in a follow-up email. We'll also include some supplemental information. Dr. Pugh, is it okay if we share perhaps a PDF of your slides from today? Would that be okay to share with the group?
Yes.
Okay, great. Thank you. So we'll do that as well. And there will be a couple of other items, especially the ones that Sarah mentioned earlier with some of our site enhancements and our updates. So that will be coming up. On the horizon and upcoming events, we are hosting a webinar with the American Heart Association on May 17th, and we are going to be discussing strategies to improve stroke awareness. And we are potentially having another webinar in June, which we will be announcing soon. So keep an eye on those, and please do feel free to continue to share those events and opportunities as you learn about them. We know that we have great communication with many of you, but that there are others in our region who might benefit from the information that we're sharing in these opportunities. So please do feel free to share at your discretion. And if you have not done so already, we do encourage you to sign up for our quarterly e-newsletter. And you can do this through our homepage. Right now, there's a pop-up. So when you go to healthyneo.org, it probably just pops right up, and you can either sign up or you can X out of it. There's also an option right at the bottom of our footer. So on any page that you're at on the website, you should have an option to click on the newsletter sign-up link. And I believe Sarah may have added that to the chat here as well. So please do feel free to do that. And with that being said, you can feel free to reach out to our team at any time with questions, requests. If you are seeking a demonstration request or are looking for something specific on the platform that you're having trouble with, we are more than happy to connect with you through a meeting, through a phone call, or via email as well. So please do feel free to get in contact with us through these ways. And as we are concluding, we want to invite you to share any key takeaway moments from today. So if there's anything you'd like to share, again, if you would like to come off of mute, we invite you to do that as well. But if anybody has any key takeaway or aha moments that you'd like to share, either verbally or through the chat, we'd love to hear those as we are concluding. And we thank you all also for your participation earlier with the impact statement. And I don't think I mentioned this earlier, but we will include that final impact statement as well when we send our follow-up email. Okay, any comments coming into the chat, Sarah?
No questions or anything, just some feedback on future topics.
Okay,
So
great.
appreciate that, Kat. Thank you. If
Okay,
anyone
great.
has other ideas or even, future guest speakers you'd like to see, please feel free to pass that along.
Yes, that would be great. Okay. All right. Well, this concludes our meeting for today, everyone. Thank you again for your participation, and we look forward to seeing you again soon. I hope you have a great day.
Thanks. Take care.
Thank you. Bye-bye.
Thanks, everyone. Have a good rest of your day.